Welcome back to the Deep Dive, ready for a look at today's healthcare headlines.
Absolutely. It's a whirlwind out there. Everything seems connected these days.
Doesn't it? Let's jump right in. First up, we've got some rumblings about potential cuts to Medicaid.
Uh-oh.
Yeah, this is the program, of course, that helps millions of Americans get health coverage. Can you remind us what's at stake here?
Well, Medicaid is so important,
Yeah,
It's really a crucial safety net for so many, especially low-income individuals and people with disabilities.
right?
It's also really complicated, funded by both the states and feds.
Right.
So it's very tied up with state budgets and really the entire healthcare system.
If there are cuts, what could that actually look like for patients?
Well, any cuts could have ripple effects. We could see impacts on access to care for millions of people, delays in treatment, maybe people even skipping needed care because they just can't afford it.
Wow.
Certain groups are particularly vulnerable too.
Like,
Children, pregnant women, they rely heavily on Medicaid.
this is definitely a story we'll need to keep a close eye on.
Absolutely.
Speaking of politics, did you see that Dr. Oz?
Oh, yeah.
Yeah, that Dr. Oz is in the running for a pretty major government role.
It's true. President Trump nominated him to lead the Centers for Medicare and Medicaid Services, CMS.
CMS, wow.
This is interesting for a couple of reasons.
Okay.
First, Dr. Oz has a lot of investments in companies like United Health and HCA. He'd need to divest to avoid conflicts of interest.
Ah, I see.
Second, this nomination raises a lot of questions about the future of healthcare policy.
Under a Trump administration.
Yes. I mean, Dr. Oz has actually supported parts of the Affordable Care Act, like the preventive coverage mandate.
Interesting.
It'll be really interesting to see how this all plays out.
Lots to ponder there, and the news keeps coming. California's cracking down on insurance companies.
Really?
Yeah, companies that keep denying claims without a good reason.
What's going on there?
Well, a lot of people are frustrated. Healthcare costs are rising. It's hard to get the care you need.
For sure.
California's taking a big step. A new law would force insurers to actually disclose their denial rates,
Wow.
and they'd have to justify those denials.
That's huge.
It could really shift the balance of power, put more pressure on insurance companies to be more transparent and accountable.
I'm all for that.
Me too. Okay, let's switch gears a bit and talk about tech.
Sounds good.
AI is everywhere these
It
days.
really is.
And healthcare is not exception. We're seeing some really interesting developments like this imaging startup that just got a major investment.
Oh, yeah, Vandra Imaging.
That's the one.
They're focused on making medical images, easy to share for research.
Right.
Well, they just got almost $18 million in funding.
18 million.
That's right.
That's a lot of faith in their technology.
It is. This really points to a bigger trend, too, using big data to get better at diagnoses and treatments.
The fact that these big health systems are investing, it says a lot.
It does. They definitely believe in AI's potential.
But AI isn't a magic bullet, right?
Oh, definitely not.
There are definitely some bumps in the road.
There are. Some experts are actually pushing back on what they call the scaling hypothesis in AI.
Scaling hypothesis.
Yeah, it's basically the idea that if you just keep adding more data, more computing power, you'll automatically get to, super intelligent AI.
Ah, okay.
And some people are saying, wait a minute, that's not really panning out.
So AI is still valuable.
Oh, yeah, very valuable.
But maybe we need to adjust our expectations.
Exactly.
And of course, there are always those concerns about bias in the algorithms.
Absolutely.
And privacy, job displacement, all of that.
Right. And the AMA, they just released a report about how physicians feel about AI.
Interesting. What did they find?
Well, doctors are optimistic about how AI can improve care, which makes sense, because they also have some reservations. They're worried about privacy risks, how hard it is to actually integrate AI with electronic health records.
Oh, right.
And even potential legal issues.
Yeah, if something goes wrong, who's responsible?
Exactly. It really highlights how we need thoughtful regulation and oversight as AI gets more popular.
So AI is a powerful tool.
Absolutely.
But we need to use it carefully.
Couldn't agree more.
Okay, let's shift gears one more time.
Okay.
Let's talk about healthcare systems themselves. It seems like hospitals are still struggling to keep up with demand.
They really are. Occupancy rates were actually higher in 2024 than back in 2019.
Wow.
And some researchers are predicting we could have a real bed shortage by 2032.
That's concerning.
It is. It makes you wonder, can our healthcare system actually meet the needs of a growing and aging population?
And it's not just about beds, is it?
Nope. We also have a shortage of qualified professionals.
A shortage of doctors and nurses.
All kinds of healthcare workers. It's a problem across the board, but we see it especially in primary care.
Fewer people going into primary care.
That's right. Fewer clinicians are entering the field just as demand for primary care is going up.
That's not good.
It's a big problem. This workforce shortage is a ticking time bomb for the whole system.
Okay, before we get too bogged down in the negative.
Yeah, we need a little good news.
Let's end on a hopeful note. I'm really intrigued by these GLP-1 drugs.
Oh, yeah, they're everywhere.
They seem to be everywhere.
It's a whole new world.
They were originally for diabetes, right?
Right, they're a class of medications designed for diabetes, but now they're being prescribed more and more for weight loss and other things, too.
It's pretty amazing how they've become such a major player in the pharmaceutical market.
And the sales growth has been huge.
So are they changing how we think about obesity and diabetes?
In a lot of ways, yes. GLP-1s are forcing us to rethink how we deliver care for these conditions.
How so?
Well, for example, some companies like Lilly are launching these direct-to-consumer platforms.
Direct-to-consumer?
Yeah, to support patients taking these medications. So they're providing resources, education, access to healthcare professionals, all online.
That's interesting.
It's a big shift, and it's raising a lot of debate about the role of telehealth in prescribing these drugs.
And it's not just about the drugs themselves.
Right.
It seems like they're having an impact on other parts of our lives, too.
Exactly. There was a study recently found that people using GLP-1s are actually changing their grocery shopping habits.
No way, really?
Yeah, they're choosing healthier foods, spending less overall. It's pretty fascinating.
That's incredible. So healthcare innovations can have these ripple effects, even on things like what we buy at the store.
It's all connected.
So much to think about. Let's take a moment to digest all of this before we move on.
Good idea. It really makes you think, huh?
It does. So many moving pieces in healthcare.
That's for sure.
Let's stick with AI for a minute.
Okay.
We touched on some of the potential problems like bias in the algorithms.
Right.
Can you unpack that a little more, especially when it comes to healthcare? What does that actually look like?
Well, one of the biggest issues is that AI is only as good as the data it learns from.
Makes sense.
So if the data used to train an AI algorithm is biased, the algorithm itself will be biased.
So it just perpetuates the problem.
Exactly. And that can lead to some serious consequences, inaccurate diagnoses, treatments that aren't effective. It could even make existing healthcare disparities worse.
So garbage in, garbage out, as they say.
Basically.
And there's another limitation, right? AI isn't human.
No, it's not.
It can't really understand the human side of things.
That's right. AI is great at processing information, making calculations, doing all that super fast.
Right.
But it can't really grasp, like, human emotions.
Or the social factors that play into someone's health.
Exactly. All those complex things that contribute to a person's well-being, AI just doesn't get it.
So it's a tool.
It is.
A powerful tool.
Yes.
But we have to use it wisely.
Absolutely. And that's another reason why concerns about physician burnout and the workforce shortage are so important.
Right. We still need skilled humans in the loop.
We do. We need compassionate healthcare professionals to make sense of the AI insights, to apply them in the real world.
So it's not about replacing doctors with robots.
Nope.
It's about giving doctors better tools to do their jobs.
That's the goal. And actually, a lot of AI developers are focusing on that.
Oh, that's good to hear.
Yeah, they're creating tools to help streamline things, like administrative tasks, scheduling appointments, processing insurance claims.
So doctors can spend more time with patients?
Exactly. It frees up their time for the things that really matter.
That sounds promising. Any other examples of how AI is being used to improve things for doctors and patients?
Oh, tons of examples. Some hospitals are using AI in their emergency rooms to help with triage.
Triage?
Yeah, to quickly figure out which patients need to be seen first based on how serious their condition is.
Oh, that makes sense, especially with the staffing shortages.
It can really help make sure the most critical cases get attention right away.
Smart.
AI is also being used to look at medical images, X-rays, CT scans.
Right.
It can sometimes pick up on subtle abnormalities that a human might miss.
Wow.
And that can lead to earlier diagnoses, better outcomes for things like cancer.
It's amazing what AI can do.
It is, but we have to remember there's a cost to all of this.
Financial cost.
Yes, developing these AI systems, implementing them, maintaining them, you can be really expensive.
So hospitals have to weigh the pros and cons.
They do. They have to decide, is it worth the investment?
Speaking of investments, we were talking earlier about the possibility of bed shortages in hospitals.
Oh, yeah.
What are hospitals doing to try and address that?
Well, some are building new facilities or expanding their existing ones.
That makes sense.
Others are trying to get more efficient with how they use their beds.
Okay, how so?
Things like improving discharge planning, making sure patients have everything they need when they go home.
Right.
And reducing unnecessary readmissions.
So people aren't going back to the hospital if they don't have to.
Exactly.
And of course, preventative care plays a big role too, right?
Absolutely. If we can manage chronic conditions effectively, keep people healthy in the first place,
Right.
that can really help keep them out of the hospital.
But there's that shortage of primary care physicians, which doesn't help.
It's a tough situation. To try and deal with that shortage, some healthcare organizations are trying out new models of care.
Like what?
Team-based care, for example.
What's that?
It's where doctors work closely with nurses, pharmacists, other healthcare professionals.
Okay.
Everyone's working together to provide comprehensive care to the patient.
So it's a more collaborative approach.
Exactly. We need to use all the resources we have, be creative, to meet the growing demand for healthcare.
So even with all the challenges,
Yeah.
there's still room for optimism.
There is. There's a lot of innovation happening, a lot of people working hard to solve these problems.
That's good to hear. It sounds like healthcare is on the cusp of some major major changes.
I think so. It's an exciting time to be in this field.
Okay, let's get back to those GLP-1 drugs for a minute.
All right.
They're really fascinating, not just for their medical benefits,
Right.
but also for how they're impacting people's behavior.
It's pretty remarkable, right?
It is. People are actually changing their eating habits because of these medications.
And saving money on groceries?
It's amazing. These drugs were meant for diabetes,
Originally, yeah.
but they're having these ripple effects far beyond that.
It seems like they're helping people make healthier choices overall.
It really shows how interconnected everything is.
It does. You make one change, and it can have all these unexpected consequences.
Sometimes good consequences.
Absolutely.
Okay, so we've got these GLP-1 drugs shaking things up, and the companies that make them are having to adapt.
They are.
We were talking about Lilly earlier, how they're launching this direct-to-consumer platform.
Right, Lilly Direct.
To help people taking GLP-1s for weight loss, obesity.
It's a whole new way of thinking about healthcare.
It is. It's like cutting out the middleman.
In a way, yeah, it's giving patients more direct access to information, to support.
I wonder what that means for the future of healthcare.
It's a big question. Telehealth is another piece of this puzzle.
Oh, right, being able to see a doctor online.
Exactly. It could make it even easier for people to get these medications, especially in rural areas, places where it's hard to see a doctor in person.
But there are concerns about telehealth too, right?
There are. Some people worry about, prescribing medications without a proper in-person exam.
Right. Could there be some risks?
It's a valid concern. We need to figure out how to balance convenience with safety.
It's complicated.
It is.
Okay, let's zoom out for a second.
Okay.
Back to AI.
Big picture.
We've talked about the potential benefits, the concerns, the practical stuff.
Right.
But we can't forget about the ethics of it all.
No, we can't.
AI in healthcare raises some really big ethical questions.
It does. Things like, how do we make sure AI is used responsibly?
Right.
How do we protect people's privacy?
What about the doctor-patient relationship? Does AI change that?
All important questions. We need to have these conversations, make sure we're using AI in a way that benefits everyone.
AI should be a force for good.
Exactly. It should help us create a more equitable healthcare system, not make things worse.
AI is powerful, but it has to be used ethically.
Absolutely. We have to keep human well-being front and center.
Compassion, empathy, those have to be part of the equation.
No question about it.
Well, we've covered a lot of ground today.
We have.
From those potential Medicaid cuts to AI and everything in between.
It's amazing how it's all connected.
It is. Political decisions, medical breakthroughs, consumer behavior, it all comes back to healthcare.
Healthcare touches every part of our lives.
It really does. Thank you so much for sharing your expertise with us today.
My pleasure.
And to our listeners, thank you for joining us for another deep dive into the world of healthcare. Stay curious, and we'll see you next time.